Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Haematemesis. What is Haematemesis? Hem means blood and emesis means vomiting. So Haematemesis transpires blood vomiting. What are the causes of Haematemesis? Bleeding ulcers, gastritis, gastric varices, tumors in esophagus or stomach, hemorrhagic fever, prolonged retching or vomiting, radiation exposure, heavy, hard, excessive cough, tear of esophageal mucosa, and this is named disease Mallory-Weiss Syndrome, vascular malfunction of gastrointestinal tract, addictions, and others. What are the general symptoms of haematemesis? Anxiety, panic, bizarre behavior. Bizarre means actually peculiar. You cannot explain the behavior of the patient. Delusions and hallucinations, these are everything comes from bleeding. This bleeding gives rise to this type of peculiar symptom: delusion, hallucinations, bizarre behavior, severe mood swing, depressions, feeling of guilt, loss of appetite, loss of enjoyment related to things which they enjoyed previously, and simultaneously thought of suicide, self-harm, and harming their child. These peculiar symptoms come from loss of bleeding, blood actually, from loss of blood. How causes of haematemesis are diagnosed? Following procedures are adapted to look into the causes. Number 1, blood tests for knowing oxygen iron level in blood, because mind it, these levels also functionally may cause severe bleeding. Simply oxygen level and iron level in the blood. Endoscopy, most informative approach. On the right hand side, a picture of endoscopy has been shown. This is a very conspicuous experiment, most informative approach, because this endoscope gives an internal picture of the intestine. But it is also sure it may not be successful in every and each cases. So multiple tests are important. That's why bowel movement sample and CT scan. Bowel movement sample is an old experiment known from maybe 30-40 years back, known from that period. CT scan, endoscopy, these are latest tests. CT scan also very important, may show the source of bleeding, tear, obstruction, tumor that may cause bleeding. CT scan is also very conspicuous, that is visible type of experiment. These are generally followed to know the exact cause of haematemesis. When to see a doctor in case of haematemesis? In case of haematemesis of ladies with new babe, consult a good homeopathic physician as soon as possible, because here the lady requires a constitutional homeopathic remedy, as Master Hahnemann and Dr. Kent suggested that all the dormant signs and symptoms of the lady in labor childbirth comes to surface. As such, it is high time to treat the lady in labor. Proper constitutional treatment in such a case helps mother as well as her baby conjointly. The baby need not be given any remedy orally. Remedy should be given to mother. Baby would get the remedy from the breast milk. How to prevent haematemesis? Manage gastrointestinal condition like peptic ulcer, ulcerative colitis, gastroesophageal reflux, etc. before they reach risky situation. That is, you have to control this disease previously. Don't just let it go as it is going. If you have peptic ulcer, if you have ulcerative colitis or GI reflux type of disease, you treat them properly before they reach a serious situation. Use non-steroidal anti-inflammatory NSAIDs as less as possible. If possible, use locally, not orally. Actually, NSAIDs drugs, non-steroidal inflammatory drugs, are used as randomly. Anyone can use it. You just put a demand of your medicine or remedy, it will be given. There is no required of any doctor's prescription. But this type of disease, this type of medicine remedies may cause serious trouble if taken randomly for a long time. Stop alcohol tapping, stop smoking. Above 4 measures are enough to control haematemesis to a large extent. Recent studies, this is regarding NSAIDs. Recent studies show definite information that NSAIDs may increase risk of heart attack, stroke, high BP, gastric ulcer, gastric bleeding. You see, we are studying to prevention of gastric bleeding, and that particular medicine may cause gastric bleeding. So you have to be absolutely careful. Discussion about treatment of homeopathic remedies. China for haematemesis. Severe weakness with haematemesis, extremities cold, pulse very weak, fainting, anorexia. They feel satiated all the time. Give China 30 too early. Haematemesis for haematemesis. Blood blackish, passive or non-coagulable from injury. Body feels sore, bruised all over. Give Haematemesis 6 3 early. Arnica for haematemesis. Trouble starts after injury. Whole body feels bruised and sore. Bed feels hard even if it is very soft. Much suited for chronic cases, as Master Haem himself reported. Give Arnica 30 every 2 hours. Ipecac for haematemesis. Bright red blood. Much nausea without vomiting. Cold sweat on forehead, little thrust. Oversensitive patient. Cannot tolerate slight noise. Give Ipecac 3 hours. Pyramid for haematemesis. Blood coughing or blood spitting. Fainting, palpitation in chest. You have to give Pyramid 6 4 hourly. Carbovage for haematemesis. Body very much cold with cold sweat on forehead. Patient desire fanning on face. Give Carbovage 200 at bedtime. Millefolium for haematemesis. Spontaneous bright red vomiting. Red blood vomiting. Maybe mixed with mucus also. Give 3x every 15 minutes. Sulfur for haematemesis. When no other remedy works, troubles reappear again and again. Lips so bright red as would burst at any time. Bad smell from body. Sleepy during day, sleepless at night. Burning of palm, feet, vertex. Drink little, eat much. Leave bed early in morning to pass stool. Note, there is no symptom of haematemesis. What is the type of blood, when it comes? No, just general symptoms of sulfur has been given. If this symptom corroborates with the patients, that is, patients have this symptom, then you need not check for what type of haematemesis there is, because this is the sulfur patient generalities. This, the benefit in here, this is the generalities of sulfur patient. So you give, if this generally corresponds, and it will work like a magic. You did not go for specific symptom of haematemesis. This is thanks for the listening, and this is finished. Any problem, write down in the comment section. I would certainly attend.